using inhaler and still feeling breathless, still wheezing, still anxious about your next breath, I want you to hear this carefully. Inhalers can open your airways, but they do not teach your body how to breathe better. Okay. Hi, I'm Yuktiraj Kishore. I'm a breath coach, and today in our YouTube live class, I'll show you the missing piece most people ignore. And no, this is not about stopping your medication, it's about finally addressing the root. So today we are going to go more deeper dive into, you know, and getting this quick clarity that what is safe when you are having asthma, what are the safe practices that you can do, and very, very important, do not stop or change your prescribed inhalers without your doctors. Inhalers are life saving during acute episodes. What we are talking today is why symptoms are persisting and how to support your lungs beyond just quick relief using inhalers or taking some medicines. So what is asthma or wheezing? Let us just simplify it, and I want you all to understand that what is happening. So asthma involves what? It's an inflammation where it's your airways that are having a bronchoconstriction. So airways are narrowing it, and they are extra sensitive to the triggers also. Now, what is the symptoms of asthma? Like people feel a lot of wheezing, chest tightness, shortness of breath. So yes, inhalers help. How? They open the airways quickly. But I truly want you also to ask one thing: why does it coming back? You are using inhalers. Maybe I have come across many of my students when they joined us initially. They were using inhalers somewhere around 3 to 4 times in a day, and they were on some medication also, right? So inhalers are temporary solution. The mistake is not using an inhaler. The mistake is relying on only and only inhaler without correcting breathing patterns. So there was this. So please understand that. So the what is the cycle it is becoming? You are getting, you are sensitive, inflamed, and you get triggered, wheezing, inhaler. You are using a lot of inhalers that helps you to feel relief, and then what happens? You feel relaxed, but again you are triggered, and whenever you are triggered, you again start getting the same symptoms of wheezing, asthma, and then again you use inhalers, and then again you feel better, but again the cycle just keep on repeating. So, do you really understand that the baseline breathing is not improving? You are not improving, right? So, what do you think? What is the root cause? Should you be only dependent on medicines? Does it help you? Now that you understand that you are actually trapped in this vicious cycle where when you are having inflammation, you are taking inhalers, you feel better. After sometimes again, this cycle repeats whenever you are again getting triggered, right? So what is the root cause? Many people with wheezing also have what? Please understand that the dysfunctional breathing pattern. What is that dysfunctional breathing pattern? If you come into my live breath alignment master class, you can actually check exactly the 10 pointer assessment that we do, and that what are the dysfunctional breathing pattern. So first and foremost, I will share here also quickly mouth breathing. Okay, if you don't have any nose blockages, any chest congestion, but still you find yourself breathing through your mouth, and that's a sign of your wrong breathing. In fact, mouth breathing in Chinese medicines has been told that it is equivalent to death breathing. You're going more closer to your death. First thing. Second is fast breathing. Okay, you're breathing very fast. Third is chest breathing. Fourth is over breathing too much air and too fast also. Now what is happening when you are dysfunctionally breathing? Sabse pehli cheez, understand that there is a poor carbon dioxide balance in your body. See, in breathing process, it's not just that you are having carbon dioxide and the carbon dioxide is some kind of a villain that you need to just ex, ex exhale out of from your body. Carbon dioxide is a big helper also. Do you know that? Carbon dioxide helps to release oxygen from the cells into your tissues. So it works as a dilator. So oxygen absorption efficiency is increased when you have a you know when in your cells the carbon dioxide is present. Whereas most of such people, those who are having asthma, poor dysfunctional breathing pattern, they have poor carbon dioxide tolerance. That's the first thing. Second is airways instability. What does it mean? That means when your carbon dioxide levels are low, it can always increase airway reactivity. Your nervous system, breathlessness. Okay, your nervous system is what? Your nervous system is actually sympathetic nervous system. Breathlessness, short breaths, and that leads to further, you start feeling more anxiety, and further it creates more breathlessness because your nervous system is too much stimulated, too much sympathetic nervous system. It is in a fight and flight mode. So even when your lungs may be structurally okay, but breathing pattern keeps your whole system, including your nervous system, in the reactive mode. So please understand that what inhalers do versus don't do. First thing inhalers do, what are the when you take inhalers or puff, it relaxes your airway muscles, that is your bronchodilation starts happening when you are using inhalers, and it reduces the inflammation. So basically you are giving steroid that is there in the inhalation. Now inhalers, what they don't do, isko samjho, they are not training your breathing muscles. They are not improving your breathing pattern. They are not stabilizing CO2 balance in your body, in your blood. And they are not calming your nervous system for long term. Is this clear to each one of you? And this is the missing piece of puzzle that most of the people are ignorant of. So, what is the core? Come what may, you keep taking medicines or the inhalers, but until and unless you start correcting your breathing, you cannot feel and receive the greater benefits, or managing your asthma in a better way. So what is the way out? I remember there was this one, you can even actually go and check out in our Yoga with Yuktinis channel. There's a student story, Dr. Nivedita Kulkarni. She herself is a doctor, and she has, when she joined, she was having asthma and headache issues. And that time her this and she was on inhaler and medicines, and her situation was becoming little worsen. So she went to the doctor, and doctor has increased her dose. She was very breathless, even climbing, walking also. So that's why she joined us, and she retrained her breath. And when she retrained her breath, she was able to retrain, of course, her nervous system. And initially, she was on, everyday inhalers, everyday medicines, and within 3 weeks only, that has got tremendously reduced. Once in a week, every day, 3 to 4 times. In the 3 weeks of practice, she was just using it once in a week like that. So, what changes? So, I'm going to share with you the secret that you must follow to improve your asthmatic condition gradually. And I will also share with you that what you should not be doing. Okay, so what is the mantra? The foundation is, first is nasal breathing. Second is nose inhale and nose exhale. Okay, this is how you should be breathing. Why? Because when you breathe in through your nose and out through your nose, you are actually filtering the air. As well as when you are inhaling through your nose, the nitric oxide production is happening, and that is very, very important. It supports your airway dilation, it improves your oxygen efficiency. So nasal breathing, that is the first foremost point. Make sure that you are using your nose only to breathe. Second is slow breathing. Okay, so breathe slow. It will help you to calm your nervous system, and it will reduce your airway reactivity also. Then third is gentle breathing. What does it mean, gentle breathing? That means less volume. It helps you to restore your carbon dioxide balance, reduces air hunger sensation over the period of time. So gently breathe. Sometimes you will find that people are breathing very harshly, means lot of noise. Even if you are talking to them on over phone, you can hear their hear the sound of their breathing pattern. Okay, so what people should not do in asthma especially, please understand, that is that they should not force themselves to do some typical complex breathing that may be even harmful for them. So what did I teach you today? I teach you this one thing, that is start with nasal breathing. Make sure that it is slow, and make sure that you are breathing gently. Very, very important. Very, very important. Okay, so today I'm gonna share here with you a couple of breathing practices to start with. And if you're someone who would love to learn more in a structured way to overcome these challenges, you're most welcome to be the part of our breath alignment masterclass. A lot of workshops we keep doing. You can check the description and be the part of it. Yeah. So let's try a safe and gentle practice, everyone. Sit comfortably, keep your mouth closed, your lips are closed, and only breathe through your nose. Okay, as you inhale, I want you to inhale for 4 seconds. Expand your belly, keep your chest relaxed, very, very important. And as you exhale, exhale for, let's say, a little longer, 6 count. Longer exhalation is a signal. It's a language that your brain understands, that and your nervous system understand that it has to be in a calmer state. So narrowed exhalation, longer exhalation helps you to get into a more calmer state. Not narrowed, but longer exhalation. If you're breathing out through your mouth pursed lip, this is another practice. Then narrowed pursed lipped exhalation is also very, very calming. And longer exhalation helps in reducing the nervous system activity. So let us begin, everyone. Simple breathing practices we will do. No force, just being very, very present. So, this is a level one practice that you all can do. And tell me, how do you feel? You can keep your right palm over your belly, okay, here above your navel, another hand over your chest. Inhale, belly expand. Exhale, belly goes in. Breathe in. Keep your chest relaxed. Exhale, belly goes in. Breathe in. Exhale. In. Out. In. Out. In. Out. In. Out. Now, a little more longer exhalation. In, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale through your nose, expand your belly. 4. Exhale through your nose only and let your belly force goes back. 2, 3, 4, 5, 6. One more round. In, 2, 3, 4. Exhale. 2, 3, 4, 5, 6. Take a deep inhale and deep exhale. Just practice abdominal belly breathing to start with. At least give yourself a good 4 times 10 minutes throughout the day, morning, afternoon, evening, and night before you go to bed. Just practice and practice consciously breathing, consciously becoming aware of your breath and abdominal expansion and contraction. As you exhale, you start feeling. Once you master this, that means once you are comfortable, once your lungs, your breathing system has been retrained, because now you are retraining, then you will go to the next step. That is, now we will introduce the breath hold. That's very important, because then you are actually balancing carbon dioxide in your body using the CO2 tolerance practices. So there is a very renowned author, James Nestor. His book is Breath. I would highly recommend, if you wish, you can read that book, and that would be a complete eye opener for you. In that book, he has mentioned, that how asthma can and wheezing issues can be addressed using the breath. So what you can do is start introducing breath hold. Inhale and exhale fully and hold your breath. This is one another practice that you can do. In, out, 4, 5, 6, and hold your breath. 6. In, out, hold. In, out, hold your breath. 5, 6. Relax, everyone. Now, these are the two very powerful exercises that you can do. The other few exercises that you can introduce is your coherent breathing. That means 5 count of inhale and 5 count of exhalation. So, this is your coherent breath. Okay, you can use this breath also gradually. So, always when you are training your nervous system, don't be uh, हाथ धो के पीछे नहीं पड़ना है आपको. Okay, don't be forceful at all when you are working with your breath. That is very, very important. Imagine that you are breathing less, but you are becoming more and more efficient. Okay. So you will, what are the benefits that you can start receiving is you will feel that I'm becoming more calm. There's a chest tightness that is reducing, and there's a slow rhythmic breathing that you are experiencing. Okay, and this is how you start gradually retraining your system. And there are ample of breathwork practices that I teach in my structured program in my community, that is Wellness Abundance Hub community. We are a community of conscious and right breathers also. So never force breath holds or intense techniques if you have asthma. That is the, I feel pity, but yeah, a lot of students come to me and they say that, ma'am, I'm having asthma, please teach me pranayam practices. See, first, please understand, pranayams are advanced breathing practices. Okay, they are supposed to be practiced on a healthy body. First thing. Second thing is, they are like a pneumatic tools that are used to cut the rock. So if you do anything wrong with your pranayam practices, or you are not trained, or you are already having a dysfunctional breathing pattern, it is gonna backfire you. The practices, that your own breath will become the enemy of you. It's like hurting yourself through your breath only. So always start in a proper structured way, start gently, build gradually, and very important is that you stay safe. Always remember that one very powerful thing is that maybe your lungs are not weak, maybe you get the test done and your lungs are all okay, your breathing pattern may be inefficient. And when your breathing will become efficient, the system will start becoming calmer and more stable also. Yeah. So I hope you understood this one particular practice. And if you are having asthma or related issues, for you it is must to start retraining your nervous system using your breathing pattern, and first identify the dysfunctional breathing pattern. So if you want to go deeper, yes, you can join our upcoming masterclass. Stay tuned. We are doing it today also. If you are someone who has not yet been the part of our community, you can join now, or check if you are watching this video later. Check the group description and connect to us